Well, I want to thank everyone for coming who is here, and I'm sure we'll have some other people joining as we come along. I wanted to thank all of the attendees and all of the panelists for offering your time and expertise tonight. I know a lot of people have a lot of things going on, so we really, really do appreciate your time and all of the work that you've been doing. You can use the Q&A feature in the webinar to ask our panelists questions. They will hop in and answer as they are able. We also have questions that were pre-submitted through email and text, and at the end, we will definitely go ahead and answer those. And at the end also, please be sure to take the time to find all of our panelists on social media, follow their work, take the time to follow all of the organizations that are represented too, and follow their work. There's a lot of really important stuff going on in Pennsylvania in criminal justice reform, not just in COVID-19, but outside of COVID-19. Pennsylvania has a pretty bad mass incarceration issue, and so a lot of the people who are working here, who are represented here tonight, are working in different capacities to address that. And so without further ado, I'm going to start off the panelists because we definitely have a lot of information that we want to get out to you. And so the first panelist, of course, it probably doesn't need any introduction in this space, but we have District Attorney of Philadelphia, Larry Krasner. And thank you so much, DA, for coming on and sharing your time with us today. And go ahead, you can feel free to go.
Wonderful, thank you. I promise not to bogart the microphone here. So it's great to be on with all of you. This is obviously an issue that we all care about deeply. I'm not sure how much insight I have other than maybe to bring you up to date on what has been going on in Philadelphia, the successes, the failures, and where this may stand when we get past the pandemic itself. So what I think has been working in Philly is that we have had a very good partnership with the Public Defender's Office in recognizing that we're in a new mode here. From the prosecutor's perspective, the mode is that we have on the one hand to weigh public safety, and on the other hand, we have to weigh public health safety. Not the usual equation, but a very important equation. So for us, what that boiled down to was trying to find a really efficient, really quick way to take the people who we felt really should be out of jail, get them out, while simultaneously dealing with the reality that in Philadelphia, we have an extremely high level of homicide and of serious shootings going on right now. In fact, it has spiked since the pandemic started. So initially, it was difficult because, frankly, what was going on is that the judicial leadership in Philadelphia was dealing with what is obviously a new challenge. And their way of dealing with it was to say, well, just put everything in writing and we'll get to it. When you're dealing with 4,800 people in jail and you're trying to do something effectively and efficiently, that is no way to do it. So we started out there, and it took us a few weeks, but we were eventually able to persuade the judiciary that what we needed to do was to have what are effectively remote courts, where a single judge would look at about 30 to 50 inmates in a given day. And both sides would have prepared by looking at their situations, which obviously are often more than one case. Sometimes it's a detainer, plus it's a new case, plus something else, right? So both sides would be prepared and they would take their positions. Just thinking in administrative terms, the idea was let's find categories that are the most likely to include a lot of people who should get out. So we went for the lowest hanging fruit, as they say. We then went up to stuff that wasn't at the lowest level, but was still fertile ground for finding people who both sides could agree should be out of custody. Some of the lowest hanging fruit was, for example, people who had already completed their county sentence, meaning they'd completed the minimum of their sentence, and in ordinary times probably would have already been paroled. But when the pandemic hit, all the power was taken away from individual judges, and the power was placed in a small number of judicial leadership. So we immediately had a bottleneck that we had to deal with. Another category, of course, was people held on bail, and then there were people who were coming close to their minimum date. There were people who were just held on technical detainers. I could go on and on, but I'm sure you get the point, is that we looked for categories where we felt there would be a very high portion of people that the defense, prosecution, and judiciary would agree should get out. And so phase one was motions. Phase two was a simultaneous process of motions and then also these streamlined hearings. I would say early on in the process, we were looking at maybe 2/3 or 80% of the inmates getting out. As we got farther along in the process and the decisions became more controversial, that reduced, but we still ended up with a reduction from about 4,800 to about 3,800, a reduction of about 1,000 people through that process. And I would say over 50% of release was granted by the court at a rate of over 50%. That was somewhat successful. I would compare it, though, to somewhere like Pittsburgh, where I think they were significantly more successful. In Pittsburgh, instead of having what we had in Philly, which is that the probation and parole office basically went home, and based on the information I have, we're operating under the notion that you don't even check your voicemails when you go home. There's no reporting going on. I'm not actually making that up. That's what happened in Philly. But what happened in Pittsburgh is that the probation and parole department, which frankly has a much better reputation, went to the judiciary very early, even before the pandemic fully hit, with a list of approximately 250 people whose detainers they felt should be lifted. They had a system that fairly closely monitored the people who they thought would be the safest on the street, and they were very proactive. Last time I checked in Pittsburgh, they were looking at more like a 30+% reduction in their county jail population. Philadelphia has gotten to about 20% at this time. And of course, there have been other jurisdictions that have also been more successful. But I will say this, I think no one should forget that it wasn't that many years ago that Philadelphia had 10,000 people in its county jail system. And there was a lot of work done by people before I ever became the DA that knocked it down to 6,500 when I became the DA. And then there were certain things that we did either individually or with some of the partners that brought it down a lot from there, that brought it down to about the 4,800 number that we came to. So can you imagine what this would have been like if you had 10,000 people, if you had people triple celled, and you had massive double selling, and you had these bunk rooms that basically were overflowing? It would have been a complete disaster. We have had a confirmed death of an inmate in our system. I have information that is not confirmed suggesting that there may have been another inmate released ill who died shortly thereafter. I do not know that to be true. I do not know that to be false. I have received information that I can neither confirm nor deny that there may have been the deaths of 2 prison social workers. I don't know for sure, but I can tell you that it has been absolutely heartbreaking to look at the situations of people who work in those institutions and to understand and hear the desperation of people who are involved at every level. I'm speaking of the inmates. I'm speaking of the people who work there. I'm speaking of everyone's family outside there. And I'm frankly talking about your grandmother and my grandmother, because those are the people who are most likely to die as a consequence of all of this, and they're not in the jail. So it has been a struggle. I think we've made some progress, but we're now moving to what I consider the next frontier. And this will be extremely important. We're all kind of in crisis mode. We're thinking in crisis mode. Well, I want you to think for a minute what it's going to look like to try to run a courthouse. Because in Philadelphia in the morning, for the 33 years of my career, and I spent 4 to 5 days a week in court for the first 30 years as a public defender and as a defense attorney, we used to jam 4,000 people through the doors of the Criminal Justice Center, or before that, City Hall. We jam them in there between 8:30 and 9:30 in the morning. They all get on the same elevators. They ride to the same floors. They're 4 and 5 deep in the bathrooms. They're all the way up and down the halls. There's nowhere to sit. And you frequently have people basically sitting in pews like they're in church. Cheek by jowl, to put it mildly. That is not possible anymore. We all recognize that. Maybe in 3 years, maybe in 2 years, not today. And the consequence of this is going to be you're not going to see jury trials happening as soon as the courts open. You may not see them happening for quite some time, no matter what the courts say. You're going to start to see an effort to deal with cases and to address cases with courts that are remote in ways that the law has not allowed and in ways that we're not accustomed to doing. Some of that is positive and some of that needs to happen. But all of you need to be incredibly vigilant that the public has access. And I mean, they can see it, and I mean, they can hear it, that witnesses on both sides have access. And I mean that they can be seen and they can see, because what is going on in Philadelphia at this point is we're about 6 weeks into a struggle to make sure everybody remembers that in the US Constitution and in every local constitution, meaning every state constitution, there is a right of public access to trials. It comes out of the Star Chamber proceedings, which we do not accept and we should never accept. And there is a right of press access to trials. And the truth is that in Philadelphia, there have been some problems with it thus far. We are doing everything we can to change it. I expect it to change soon, but there will be no accountability in how things are done unless you're in there watching and unless you are able to do a lot more than get a little piece of the action. It's not good enough to walk into a courtroom and have somebody pull a giant curtain in front of you and say, you can hear, but you cannot see. We would never accept that in a live courtroom. It's not good enough to say, well, the press can come in, but the public can't. We should never accept that because we're going to get terrible results. Nevertheless, for people who care deeply about mass incarceration, you have to have a functioning court system. Justice deferred when you have a bunch of people sitting in custody, when you have victims, when you have people who need to get outcomes from these cases, really is justice denied. And if we do not have an effective door that is an exit door from the jails, and the only thing we have is an entry door to the jails because arrests are not going to stop, you're going to see an increase in incarceration across the board, possibly like nothing you've seen before. So I will quit because I'm almost at my 10 minutes, but I want to say this is the next frontier. It's how do you do remote courts, and how do you do them right? And how do you do them so that we are all accountable? And yes, I mean prosecutors too. Thanks very much.
Thank you so much, DA Krause. We really appreciate it. I know you're very, very busy, but thank you very much for joining us. I want to now turn it over to Joshua Alvarez, who is the Director of Prison Monitoring for the Pennsylvania Prison Society. Josh?
Perfect. You can hear me? Great. So I'm Josh from the Prison Society. The work that we do at the Society basically falls into three buckets. The work that we do for the men and the women on the inside to make sure that they are safe and secure. It's the work we do for their families to keep them connected and to make sure they're informed of everything that's happening on the inside. And it's the work that we do for the broader public to educate them around the issues that might be happening on the inside and to advocate for systemic change. And so really, since the start of everything, we are a small staff, but we have been working in overdrive to stay faithful to the issues that we are concerned with and with the loved ones that are on the inside. And so I think the pandemic really confirms what we already know, that prisons and jails are questionable on a good day, and then you throw in a pandemic and it gets really complicated. And so since the beginning of one of the first things that we did since the beginning of the pandemic was really try to learn how the different jails were preparing to mitigate the COVID risks in their particular facilities. And so we sent out a questionnaire to all the county jails to learn what they were doing. We got a lot of answers back. We analyzed these answers, and what we did is we prepared some guidance, some no-cost or low-cost guidance of things that they should do to help mitigate the COVID risks. We sent that to the wardens and to the county commissioners, and we've had success with a lot of counties have been able to implement some of these. We've had a few counties that were able to waive their medical copays in response to this, so that was a good success. Another thing that we were doing, we were lucky enough to be the lead petitioners of the ACLU's King's Bench petition. I'll let them talk a little bit more about that, but what that essentially did was that punted a lot of these issues to the precedent judges. Something that we're really excited right now and that we're doing right now is really trying to understand how the individual counties are responding to this ruling, to learn how are they decreasing their populations. Through a partnership with the Vera Institute of Justice, we are collecting all that data. We plan to present this sometime next week. But what we have learned has been insightful. We've learned that there have been 18 counties across PA that have decreased their population by more than 20%. And so we are learning a lot of information. We will share this, so definitely stay tuned to that. And on top of this, the work that we do continues. In a single month, we respond to about 250, 300 individual asks for information or assistance from either a loved one or someone on the inside. In the month of March, we did over 1,000. And so we still remain a resource for families that might be concerned for their loved one on the inside or for the incarcerated person themselves. Another exciting thing that we're doing is we are doing a mass survey. We are really trying to learn what this experience is like for the incarcerated community. We sent out a survey. We're continuing to do this. It's simple questions like, do you have sufficient soap? Do you see the prison disinfecting common areas? Are you still able to access medical care? We've already got over 150 responses. We are getting more through an academic partnership with CMU. We are going to analyze this data. We are going to be able to report out accurate, or hopefully as quick as we can, about what this experience is like for them. And so that's another good thing to stay tuned for. We're working in this virtual world. Our volunteers are learning how to do their monitoring through different ways. We've had success in learning how the different counties are allowing us to do alternatives to in-person monitoring. We recognize the need for direct interaction with the incarcerated folks that might be asking us for help. And so we're definitely trying to get back to there, but until we can, we need to make sure that we keep them and the volunteers safe. And so just other things to keep on the radar, and definitely keep your eye out for the information that we're going to send out about the county jails along with Vera. We still remain a resource for families and for those on the inside. If you know somebody's having a concern, feel free to send it to us. We're always happy to try to help. Everything that we get, everything that we learn, we put on our website. We have a COVID landing page that's dedicated to everything that we hear. Our goal is to not only encourage transparency from everybody, but to share everything that we get out. And then feel free to subscribe to our updates. We send out 2 updates a week about everything that we're hearing, about everything that we're learning. We are a small but mighty staff. Our reach is amplified through our volunteers and our supporters, and we're definitely here to help.
Thank you so much, Josh. We really appreciate it. And we also love your new haircut. So I also now want to move it on to Jenna Mole, who is the Deputy Director of Justice Action Network. Jenna?
Thank you, Celeste. It's such a pleasure to be with you all virtually and see some of your faces again. Used to be able to be with you in person, but under our new normal, it's great to just have this. For those of y'all watching who I've not yet had the pleasure of working with, the Justice Action Network is a national bipartisan coalition of some of the most effective groups on the left and the right, all of which are advocating for effective criminal justice reforms at the state and federal level, and some of whom are on this webinar with us, which I'm always thrilled by. On the issue of COVID, we've really been focusing on things that governors can be doing very quickly and very effectively to respond to this, along with some of the sheriffs who are trying to control this within their jail spaces, DAs who have been working really hard on this, legislators. There's a few legislatures across the country that are still in session and are actually passing really good reforms right now. But the thing that I wanted to make sure that I use my time on and to make everyone aware of is what's going on at the federal level. And there's 2 major things that are happening that everyone should be aware of and ready to be talking about. One is in the forthcoming kind of phase 4 congressional relief legislation. We know there's going to be some level of focus on state and local governments and the expenses that they've had to deal with COVID, the challenges they've been facing, and we want the criminal justice response to be a part of this. But not just any criminal justice response, it should be an effective criminal justice response to COVID. And so the Justice Action Network convened a working group of about 20 criminal justice stakeholders from across the country, including Secretary Wetzel from right there in Pennsylvania. His fellow working group members were sheriffs and DAs and public defenders, corrections officials, I mean, folks that are seeing this every single day and could give us a really good glimpse of the challenges that they're facing, what they need in order to safely move more people out of jails and prisons into community-based settings, and how to stem the tide of COVID-19 inside jail cells. And so we are right now actively taking their recommendations and their firsthand reports and compiling them into a report that's going to be released. And then that's going to be used to inform Congress as they're putting together this legislation. I'll give you guys a quick preview, but make sure to send around links to the reports and all of that when it's final. But the biggest thing that we hear, and this is not going to be a surprise to anyone on this, but the biggest thing that we heard from our working group is that they need funding for effective alternatives to carceral placements, whether that's prison or jail. There are a lot of folks that want to be moving individuals outside of prison and jail, but they just don't have anything to do. They have nothing. And so that's a structural problem that's been long inherent in criminal justice, but it's even more pressing now. So I think that their biggest recommendation to Congress is going to be to fund those effective community-based alternatives so that we have more resources to move folks outside of jail and prison. Second one is really going to be focused, I think, on technology, making sure that we have ways of contacting folks, of holding court appearances, of doing different sorts of check-ins that doesn't require people to come in physically. That's a great way not only to protect people involved in the criminal justice system, but the corrections officials and probation officers themselves. A lot of courts simply do not have that technology and do not have the resources for that technology. And the third major bucket is looking at workforce and reentry. So we've got people that are exiting out of prison and jail at a higher rate than we've ever had before. We need to make sure that we're connecting them to the resources that they need to successfully reenter society, whether that's transportation or housing or access to resources to look for a job or something like that. If Congress is going to be putting money into the states to focus on this, that needs to be a part of that. So I'm really excited about those recommendations and really looking forward to seeing this working group kind of share their expertise with Congress and hopefully that'll move the ball forward. But I wanted to make sure to mention that to y'all. When you see this coming out, please help us in amplifying it and raising that message and saying, we agree, this is what we need. The other major thing, just real quickly to make you all aware of, is, as many of you know, the Paycheck Protection Program that was part of the phase 3 response that Congress passed has unfortunately been limited by the Small Business Administration. Even though Congress never used this language or never put these limitations on the PPP, when the SBA implemented this, they limited individuals with certain criminal records from having access to the PPP. It's a pretty broad limitation, actually. It's any felony conviction in the last 5 years and anyone that's on supervision for basically anything. And that's really counterintuitive, right? Like, we want people to have access to these funds just like anybody else, and especially those who have had contact with the criminal justice system. We need to be supportive of them and helping them to successfully run their business and move beyond this. And so we are going to be working both with SBA officials, the executive branch, as well as Congress, to see if we can get a fix in this, to make sure that this fund is available for everyone. So those are two really big things moving. Would love support from everyone, both on this panel and everyone watching. We'll make sure to send around more details and the follow-up information. But Celeste and everyone else, thank you so much for having me with you.
Thank you so much, Jenna. We really appreciate your time also. So now we're going to move to Jessica Jackson, who is the Chief Advocacy Officer from the Reform Alliance. Jessica?
Make sure I unmute myself since I've had quite a few technology glitches all day. Thank you for having me on. So like Celeste said, I work at the Reform Alliance, where we're really focused on community supervision, probation, and parole. And we've been working hard ever since the epidemic hit. First, Erin Haney, our policy director, who many of you guys know, began, as soon as we heard that COVID was coming. I think, it was sort of a slow roll. Is this going to actually come to the United States? What is this going to look like? But as soon as we realized how serious this was going to be, right away, both Erin and I, who have spent, the last 15 years plus going in and out of jails and prisons, realized that that was going to be where it hit the hardest. And we started working with experts across the country that Erin pulled together, mental health experts, medical experts, corrections experts, to put together a 7-page policy plan called the Safer Mitigation and Prevention Recommendations. Those recommendations really address, start to finish, everything that you need within the justice system to try and prevent the spread and mitigate the spread inside of the facilities. We were hoping we were going to be able to help prevent a lot of people from, getting this virus inside. And we took those recommendations, and in partnership with many of the other groups, including American Conservative Union and National Urban League and others who, might not always be on the same side of every issue as us, but really felt strongly about this. We brought them to the National Governors Association and the Correctional Leaders Association, and we were able to partner with them and get them out to DOCs across the country, to governors across the country. We've been doing technical support and assistance to 26 different governors' offices at this point. And one of the things that we realized very early on, even though our recommendations dealt with supervision and dealt with, releasing people, dealt with protocols for if somebody was showing some of the symptoms inside, dealt with protocols for if somebody tested positive, protocols for, testing guards as they were coming in and out, because we knew that they were likely going to be the ones who brought it in. We didn't have a very key piece, which was once we're releasing everybody so there can be social distancing, we also wanted to make sure that we were preventing more people from coming into the system. So at that point, we launched the Safer Policing Plan, which we were able to, again, organize some incredible groups around and get out to the National Mayor's Conference and the International Association of Chief of Police as guidance. Maybe right now when sending a person to jail for something like jumping a turnstile could be a death sentence, maybe we shouldn't be doing that. Maybe we should be focusing our police resources, which are scarce, on distribution of food to elderly, distribution of materials about COVID, giving out masks to people, et cetera. So we were able to get those out the door as well, and address a different, part of the system. And then the final piece of that project was that as we were talking to all these governors' offices, we actually had a lot of people who said, I want to do some of this stuff, but we don't even have PPE for our hospital workers. How are we going to provide it for people in jails and prisons? And that's when we launched our big PPE drive. We've to date been able to donate 300,000 masks across the country to different jails and prisons. It's nowhere near enough. We're still working to get more out there. And we've actually just recently launched a campaign called Answer Their Call that's you can find on Reform Alliance, on our Twitter, on our Instagram, on our website. And it's calls from people inside talking about what they're experiencing, talking about, wanting to survive, to make it home to their children, which is just such a, as a mom, it just makes me so emotional to think about, what people are going through inside who are, feeling like they've been sent there to die at this point, even though that was never their sentence. And then to DA Krasner's point, a lot of our message has not just been about people who are living inside of the facilities, but also the people working inside of the facilities. And I think that has proven, to be very, very true. We just saw an article today that said over 5,000 correctional officers have tested positive at this point. And we know that those are folks who aren't just sitting in the jails and prisons, right? They're going home, they're going to their families, they're going to the grocery store, they're out in the community. And we've seen places like Marion prison where over 80% of the facility tested positive. It then began to seep into the community. And you saw, a direct correlation between where people who worked in that prison and where people who, where they lived. You saw the virus spreading. And so it's very obvious that, our jails and prisons aren't containers, right? They're facilities that very much impact our communities. So even if people don't care about what's happening to people inside of the prisons and jails, which they should care also about the public health issue and public safety issue of it coming back out into their communities. So our final project now, as we're watching all of the states open back up and come up with their plans, is we put together the safer supervision and opening plans. Aaron just sent me over a copy of those policy recommendations. We're going to be circling them to all of you guys, getting them out to governors, because I think, as DA Krasner was saying, the world is going to look very, very different moving forward. And we don't want to see a bunch of people sitting together in a courtroom, afraid that either they have to show up there and risk their life, or they stay home and risk going to jail, right? Or getting a warrant and then, possibly getting the virus as well. We also don't want to see probation offices filled up with people, right? We don't want to see people going back in because of a technical violation. And frankly, I don't have as much faith in our federal government as Jenna seems to, but I think this is an opportunity with the states, looking for where they can have cost savings programs. We know that some of the reforms that we've been working on for the last 2 years in Pennsylvania and other states are cost-saving programs that actually increase public safety. So we're working on wrapping all of that into our final recommendations that we'll be publishing and putting out. And I just want to thank you guys so much for pulling this together and having this very, very.
Thank you so much, Jessica. I really appreciate your time and all the work that Reform is doing. So now we're going to turn it over to Robert Salim Holbrook, who is the Director of Community Organizing for Abolitionist Law Center. Salim?
Yes, thank you, Celeste, for having me on this, and thanks everyone for joining. At the onset of this, very quickly, we knew that social distancing was impossible in prison, so we started advocating decarceration as a way to address the possibility of a massive outbreak of COVID-19 in state and county prisons in Pennsylvania. Unfortunately, that really has not been, the powers that be have not really been receptive to that. There's almost a stigma around decarceration that has been very disappointing to us, to say the least. Early on, we asked the governor to exercise his reprieve power to create some social distancing room within the Department of Corrections. And initially, it was very promising. The numbers that were supposed to be released were supposed to be anywhere from 1,200 to 1,800. Unfortunately, it was going to leave out non-violent offenders and a large category of offenders who would benefited the most from this, specifically members of vulnerable populations. But as of today, only 139 people have been released, and it's been over a month. So I think it's fair to say that Reprieve in Pennsylvania is dead. And we are very disappointed in not only the lack of leadership in Pennsylvania, but the absence of leadership. And I think in Pennsylvania, we're seeing something that we're seeing all around the country, and that is that we're living in a failed state right now when it comes to handling this pandemic. We see that there's not an infrastructure in place to handle it, and we see that vulnerable communities are being left out. Some things that we have done immediately is we've reached out to the Department of Corrections, and we've identified their vulnerable population within the Department of Corrections, nonviolent and violent offenders. And we've come up with a program, a plan for them that would expedite these prisoners' releases. And so when I say vulnerable populations, I'm talking about people who are age 60 and over. And presently within the Department of Corrections, there's something like 4,200 people who are now, there's 4,200 people who are over the minimum sentence and within 1 year of their maximum sentence. So that means they served their minimum sentence and they're 1 year to maxing out of prison. We asked the Department of Corrections to expedite this group of category of prisoner for release through presumptive parole. And that means that they have remained misconduct free, if they have completed all of their prison programs, if they have, like what we used to say in prison, jumped through all the hoops, then they should be paroled. If they don't present an immediate threat to public safety, or unless there's a statutory reason that prevents them from being paroled. So that's one category of prisoners we asked the Department of Corrections to release. Another thing we did was we asked for expedited parole review, revoking of pre-existing parole hits, and adoption of a presumptive parole policy for individuals aged 60 and older who have served their minimum sentence. Presently in Pennsylvania, there's over 1,124 individuals, 29% of those who are in DOC custody who are over 60 years or older who meet this criteria. So that's over 1,000 prisoners right there that could be expedited for release. And these are the Department of Corrections' own statistics of their vulnerable populations that we were able to get from them through a right to know request. Another thing we did was ask for expedited parole review, revoking of pre-existing parole hits. And what I mean by parole hits is people who come up for parole if you've had a misconduct. If you haven't completed a program, then you'll get a parole hit. These hits can range from anywhere from 6 months to 1 year. So we're asking for those to be reviewed. There are over 1,597 individuals who are age over 60 and over who meet this criteria. They constitute 39% of people in DOC custody who are over the age of 60. So that's over 1,500 people the DOC can start expediting for release right now as a way of decarcerating, as a way of creating breathing room, because we address this from a triage perspective. You can't social distance in prison. You have to start releasing members of the vulnerable population. The members of the vulnerable population constitute the least threat to public safety. They have aged out of crime. They have people who are age 60 and over have like a 2% recidivism rate. So these are people who should be prioritized for release. Presently in the DOC, there's over 327 people, 8% of those who are over 60 years old, who are within 1 year of their minimum sentence. We're asking them to be included in Governor Wolf's Reprieve Order, regardless if they have a violent offense or not. We're asking for them to also be given presumptive parole. That's 327 people who could be expedited for release, processed for release. Another group of prisoner is a group of prisoners that unfortunately is often overlooked, but constitutes one of the largest vulnerable populations in the prison, and that's lifers. There's over 700 lifers in Pennsylvania who are over the age of 65 years old. In 1980, there were only 12. Today, there's over 700. This group of prisoners, many of them have 40, 50 years in prison. We are asking for them to be considered for expedited commutation hearings, because the commutation hearing in June have been canceled, which is totally irresponsible. The reason for them canceling it was because they said that they couldn't do it over Zoom. The whole country is working from Zoom, right? You know, we have 90-year-old grandmothers who are talking to their great-great-grandchildren through Zoom. And the idea that the Department of Corrections cannot use Zoom, cannot use some teleconferencing feature or structure to have commutation hearings for lifers is completely ridiculous statement, especially as someone who has went through the process of parole on the inside. They are taking parole applications down. Hundreds of parole applications are being processed in the Department of Corrections now. They could have commutation hearings if they want. So we have 700 lifers who are age 65 and older who we believe should be considered either for commutation or also be considered in the governor's reprieve order. And just to give you some context here, the governor's reprieve order has only released 139 people. FCI Huntington in central Pennsylvania, as of today, has like 109 cases of COVID in that one prison alone. So if we were to release that 139 people from FCI Huntington, it still would have done nothing to create any social distancing within FCI Huntington, which has a population of close to 1,700. So this is the urgency that we're seeing in Pennsylvania. And as closing, there's just one thing that I do want to talk about, and that is, you know, we have to approach this with facts over fear. And unfortunately, when we start talking about decarceration, you know, fear is something that drives this narrative. Decarceration does not increase crime. The DOC's own crime lines report confirms that the Pennsylvania prison population rate does not correlate with either national or statewide crime rates. The crime rate has dropped over the last 20 years in Pennsylvania, and also dropped during the same 6-year period that the prison population dropped in Pennsylvania. Pennsylvania's prison population dropped by 4,387 prisoners from its peak in 2012, while at the same time, crime dropped 29%. So the statistics themselves show that people being released from prison, there's no correlation with crime rising. Another thing is that older people age out of crime, and this is something that we really should start lifting up when we start talking about decarceration and vulnerable populations now. These groups constitute the least threat to public safety. Their recidivism rate, as I said before, are some of the lowest in the country, in the state. And, you know, I believe that if we lead with that and we educate people with that people age out of crime, this is a way that we could change the narrative here and start creating space for people to have more open minds when it comes to that nonviolent and violent offender binary that unfortunately oftentimes divides us, and it's just really just unfortunately not true. You know, violent offenders who are age 50 and over, and especially those who are age 60 or over, constitute the least threat to public safety statistically. The numbers don't lie. And then in closing, the last thing I want to add is that mass releases happen all the time in Pennsylvania. Pennsylvania every year releases over 21,000 prisoners from its prisons. So the ideal that calling for 4,000 prisoners as the numbers that I've articulated earlier, the ideal that 4,000 is like a super large number. When you look at the numbers, the last 9 years, Pennsylvania has on average released over 21,000 prisoners a year. So a mass release is nothing uncommon. It happens every year, and those are some things that we should start sharing with people. And thank you, Celeste, for giving me this moment to share some of that.
Of course, we appreciate all the work, and thank you so much. It's amazing to see directly impacted people coming out here and doing all the incredible work that you're doing. So thank you for being a leader in this space. We really appreciate it. So we're going to move now to Ashley Klingensmith, who is the State Director for Americans for Prosperity of Pennsylvania.
Celeste, thanks so much for having me. Hi, everyone. It is good to see you, albeit virtually. But hey, I just want to share, Americans for Prosperity, we're headquartered in Arlington. We have 35 state chapters across the nation. And what we really do is fight to kind of take down the barriers that government has erected that are standing in the way of people realizing their full potential and whatever version of the American dream is theirs. And so for criminal justice reform work, we're really guided by a vision across all of our chapters. We really think an effective criminal justice system protects people, preserves public safety, respects human dignity, restores victims, removes barriers to opportunity for individuals with criminal records, and ensures equal justice under the law for everyone. And so it's guided by that vision that we have decided what to prioritize when it comes to state and federal policies. And so I'll talk about what we've done during this COVID-19 pandemic moment in time. But then also, I think what I'd like to do is end with the idea that we are not abandoning all of the critical reforms that we have been advocating for at the very top of our state policy priority list, because it's really critical to keep that conversation happening. So the first thing that we did, gosh, I think at the latter half of March, was sign on to the SAFER plan that Jessica had mentioned, which really outlined recommendations that the federal and state policymakers and governments at large could consider. Second, we released from our one of our board members, Mark Holden, who has been a really profound voice in the criminal justice movement for some time. He released a letter that outlined our CJR strategy. And so what I did was create a letter that was Pennsylvania specific that I sent to the governor's office and Secretary Wetzel. But I just want to talk about 4 of the main principles that were included there that we recommended for reducing the spread of the coronavirus. So first was to empower police to uphold the law and protect public safety by deprioritizing lower level offenses. Second, ensure those incarcerated, correctional officers, and staff are in clean facilities. Third, keep public safety in mind by strategically reducing jail and prison populations by using alternatives to incarceration, like home confinement, like GPS monitoring. And fourth, decrease the use of technical violations of probation and parole and use alternative video methods for meetings as a tool to prevent the spread. So sent that off, and also acknowledged in our letter the governor's ability to consider his reprieve powers. And so most folks on the line and via video know that was done. And so that was a positive step forward in immediately addressing some of the concerns. At our in our policy shop, Greg Glod, who is our Chief Policy Fellow for Criminal Justice Reform Considerations, is currently working with all 35 of our state directors to create a kind of repository of sorts for CJR actions that have been taken at the state and federal levels. It's not live yet, but it soon will be, and I'll definitely share that with Celeste so she can maybe share that with everyone that was able to join this evening. But it's literally going to be a list and links to actions that have been taken by the feds, by states, by courts, and local governments that will be on our AFP website. And so we think that'll be a great resource to house kind of comprehensively everything that's been done and prayerfully inspire subsequent actions on some of these different fronts that we've talked about tonight. We are also looking pretty deep into state budgets to see where we can safely reduce costs of corrections with evidence-based reforms, since revenue projections, as we all know, are looking pretty bleak. And so we're working with a group to get state-by-state projections of populations if certain reforms would be implemented. And so I think there was a question about budgeting, and it's a great thing to ponder. You know, I think there is going to be so much this year in spending considerations that maybe was not on the table in years past, but now that we can really take a hard look at. And then I know that Miss Jenna mentioned this earlier, but we also sent a letter to the White House, signed alongside several organizations here to advocate for the alteration of restrictions of business owners with criminal records to apply for that Paycheck Protection Program money. And so I got an update from Greg that he has been working a lot with the administration and having near daily talks about a legislative fix. And so part of our comparative advantage as a grassroots organization is being able to have activists across all 67 counties, and so here in Pennsylvania, across all 18 congressional districts, be able to scale whatever that legislative fix is to members in their district offices and through their district staff to make sure they understand and know that our expectation is, look, folks that are trying to chart a new path forward as entrepreneurs should not be denied that opportunity. And so we think this is critical. And so we also have been hosting a number of grassroots events. We have a full-time engagement team from Erie to Philly and from Scranton to Pittsburgh and everywhere in between. And so we've been hosting a number of events. So we did to just kind of scale what is happening, make sure the right stakeholders' voices are being shared with one another so that we really can all work together to identify what is working, what is not working, and where we need to deviate. So we have a Facts Over Fiction series that we have been hosting, and we had a great panel of individuals last week. We had the Pittsburgh Police on the line. We had the Elsinore Think Tank for Reformative Justice from Duquesne University. And then we had West End Power, a local Pittsburgh organizing group headed up by a great lady, Miss Terry. And it was just a very interesting conversation to have. And we really want to make sure, I think another thing that we did was have a Q&A with this great food truck called Revival Chili. It's a Pittsburgh-based food truck that is working to help folks on the front lines while maintaining an income for the folks that work there who are formerly incarcerated and economically disadvantaged. And so making sure that we are scaling what's happening in communities to our network of activists across the state has been something that our engagement team has pledged to do and has done, I would argue, really quite well. So we need to keep talking about the need for criminal justice reform because I think when everything kind of circles back and when we close the loop, it's really about reducing recidivism, and we wouldn't be having or needing to have some of the conversations that are happening now about prison populations. So I will say that we are going to continue to push our number one legislative priority, which is comprehensive probation reform here in Pennsylvania. I think nationally, 1 out of every 53 adults is on probation or parole, while in Pennsylvania, that's 1 out of every 36 people. And so shorter terms of probation will help lower that high probation rate and reduce caseloads, which has shown to reduce recidivism. And I think at the end of the day, that is what a lot of us have allocated a great deal of energy to making certain happen. So I so appreciate it. I want everyone on the call to know that it is your voice now that I think means more in the conversations happening under the dome than ever around these issues. So I would just encourage you to stay engaged and get plugged in with all of these organizations. Head to americansforprosperity.org for information that will link to that letter that I mentioned earlier from Mark, and some of our ideas for budget plans going forward for different states. So I so appreciate being included, Celeste. Thank you so much.
Thank you, Ashley. We really appreciate you and the work you and AFP are doing around this issue also. So next we have Keisha Hudson, who's the Senior Legal Counsel for the Justice Collaborative. Hey, Keisha, thank you.
Hi, thank you, Celeste, for having me. How's the audio? Good. Okay. Collaborative. The Justice Collaborative is a group of legal experts, many of us are former public defenders who have worked in the criminal justice system in various states across the country. And so legal experts, policy experts, researchers, journalists, media strategists who are working to help individuals and organizations on the ground that are working to end mass incarceration. So that's what Justice Collaborative is in a nutshell. Lately, we've been branching out into some other areas, and I won't go into that too much, but I would encourage everyone to check out our website, www.thejusticecollaborative.com, because there are a wealth of resources, not just on issues with COVID-19 and the criminal justice system, but some of the other issues that I think are attendant to the issues of mass incarceration as well. So one of the things that we've been really focusing on, and I think what we do well, is that we understand what needs to happen across the country in terms of addressing COVID-19 in our prisons. And so if you go to justicecollaborative.com, we put together a lot of resources. One of the things we've done is work with different groups on the ground to help put together these toolkits that talk about what COVID-19 is like in the prison and what the risks are, but also equip people with tools to be able to address these issues. And I think pointing out who the stakeholders are on the ground, everyone from the police to the sheriff, to the prosecutor, to the courts, to the warden in the jail, to the governor, and other local and elected officials to all play a role in the decarceration efforts. And so we've put together resources.
Keisha, you're breaking up pretty bad. I think people are having a hard time hearing you. I'm not sure what happened. I just wanted to just throw that out there. Maybe there's some place in your house that you have better reception.
Okay, yeah, I'm at, let's see here. Maybe go in the living room. Okay, I'm gonna move
there we go.
into another part of my house, and maybe that will be better. Is that better? Can folks hear me better now?
Yes,
okay.
ma'am.
All right, so just really quickly, again, Justice Collaborative, if you go to our website, one of the things we have is that we have put together a lot of different resources to help people on the ground. So many people and some different stakeholders have a role in incarceration, and so they each need to step up and do everything they need to do to make sure that we are getting people out of justice. Our guess is that we are not getting the people out of jails, and there's so much more that we can do. And so if you go to the website, there are a lot of tools and resources that can help people push for decarceration. Are you feeling issue?
Thank you so much, Keisha. So I'll just also make sure that everybody gets information. So if you miss something that Keisha said, I'll make sure that people get links sent out and everything so that you can see what the Justice Collaborative is doing as well. So now we're going to move on to Devin Reeves, who is the Executive Director for the Pennsylvania Harm Reduction Coalition. Devin?
All right, good evening, everybody. Thanks for coming out. My name is Devin Reeves. I'm the Executive Director of the Pennsylvania Harm Reduction Coalition. I'm so excited to be here with everybody. The mission of the Pennsylvania Harm Reduction Coalition is to promote the health, dignity, and human rights of individuals who use drugs and communities impacted by drug use. If one thing has become really clear during COVID-19, it's racialized policy. I think what we need to talk about is color and race. You know, we're just 2 days away from watching a video of a man being lynched in the streets of Georgia and reacting to that trauma as a society. We are seeing major cities in America where 70–80% of the deaths are people of color. And we know that people of color are disproportionately arrested and sent to jail. And, you know, that's just our analysis of the problem. That's what the data says. And I just want to name that race and racism is a huge part of what we're facing today. And what we must deconstruct during COVID, after COVID, and forever until we really rebuild a new society. As our organization, one of the things we focus on is serving returning citizens. For us, we do want to see people get out of jail. We want to see them not be incarcerated. And we want to stop that on the front end, right? We want to stop people going to jail for low-level drug offenses, for paraphernalia charges, because we've got too many non-violent drug offenders in the criminal justice system. And the smack in the face that the criminal justice system does, especially in Pennsylvania, is when somebody has a substance use disorder, also known as addiction, we don't give them any treatment, right? We don't give them access to medications for opioid use disorder. We don't give them enough counseling. And what that results in is giant overdose rates for people who are leaving the criminal justice system. Research out of the University of North Carolina stated that people that are leaving incarceration overdose at 50 times that of the general public. And so all of a sudden we see advocates across the country and across the world saying, decarcerate, decarcerate, decarcerate. And we're like, hold up. We need to give people the resources they need to get out and not die. You know, every prison in Pennsylvania should offer people who have a history of substance use disorder evidence-based treatment for that substance use disorder. And and sadly, the only prison in Pennsylvania that does that is the Philadelphia jail. Another thing that we want to see is everyone who's leaving the county jail is get a dose of the overdose reversal medication, naloxone. Prior to the COVID-19 outbreak, only 2 county jails in the state of Pennsylvania offered naloxone distribution, so somebody could have a chance to really save their lives, or have somebody else save their lives rather. And our organization in 3 weeks got 27 county jails to begin to distribute naloxone, work with them to set up those programs, and that's literally going to lead to thousands of saved lives. What we need to do in a post-COVID world is make sure each one of those correctional facilities maintains that program and that it's not just a stopgap. And we also need to see each one of those county jails begin and really refine a medication for opioid use disorder program treatment and for all types of substance use disorder. And ultimately, one of the things that we want to do is we want to stop all low-level drug offenses. And you know, that may seem wild or something that we can't do, and it's just not true. You know, we live in a world already where if you're white and you get caught with the cannabis cigarette, you don't go to jail. We live in a world where if you're white and your daddy got money and you get stopped with a little bit of drugs, you don't go to jail. We need to flatten the curve of race and racism in America. We need to make it so all people have an opportunity to survive their struggles with mental health concern. And until we start having advocates that play in the drug and alcohol lane, advocates that play in the policy lane and the public health lane, standing hand in hand like we are tonight with criminal justice reform advocates, we won't have a wholesome solution. Because it's not just about decarcerate, it's not just about access to treatment, it's about all those things, and applying an intersectional lens that centers the most marginalized people, which are Black and brown people, as part of the solution, and continue to lift up those voices. So I'm going to be quick. I know we're a little bit behind time. I'm going to pass it back to the MC Celeste. Thank you.
Thank you, Devin. So Liz Randall is up next. She's having some technical issues, but I believe I just unmuted her and she was able to call in on her phone. Liz, are you there?
I'm here. Can you hear me?
Yes, we can. All right. So this is Elizabeth Randall, the Legislative Director from ACLU-PA. Thanks so much, Liz.
Absolutely. Thanks, Celeste, and thank you to FAM for putting this wonderful event together. I apologize that I'm not able to stay on the video app. I'm mere blocks from Comcast, and yet my internet connection is unstable. So, so the ACLU, since the outbreak of the pandemic, has been busy in lots of different capacities. Certainly, obviously, with the issues around incarceration that we are focusing on tonight, I'll just mention briefly that some of the other areas that we have been active in is working on how the pandemic affects our ability to access the ballot in terms of voting and elections. We also have been weighing in on privacy, some privacy concerns and sharing of data, emergency powers, and potential overreaches of government in that capacity, police practices, in addition to immigration. And so we have a lot of really good questions, so I'm going to be kind of brief, but I just want to kind of break down what we've been doing and break it down by who the targets are of the work that we've been doing, because I think there's so many different things that we all want to fix and to address, and I think it's difficult sometimes, and it even has been for us, trying to figure out who exactly the right targets are, who is making the decisions about these, and who has the power to make those decisions. So that being said, at the state level, we kind of started with several of the organizations that are also on this call, but had sent out sort of a flurry of letters. The first sort of being to all county jails, federal and immigration detention facilities, in addition to the DOC, just trying to give them, asking them to follow evidence-based practices in their facilities. That was sort of followed quickly by communication with the Department of Health Secretary, Dr. Levine, asking her department to issue guidance to all of the stakeholders in the criminal legal system regarding the pandemic. We also recently sent a letter to the governor and to Secretary Levine asking them to collect race and ethnicity and other demographic data related to COVID-19. And really most of the work that we've done really at the state level has been advocacy around the Reprieve Order. So a couple of people I think have mentioned, I know certainly Salim had mentioned the Reprieve Order, and I just want to say a couple of things about that order. We were glad to see that the governor had used that power that he has. In Pennsylvania, the authority to issue reprieves is it's unlike most other states. Many governors do have this power, but in Pennsylvania, it is unilateral and pretty unfettered when it comes to a governor issuing a reprieve, which is a temporary release. So this is it's not a permanent release of people, but it's a pretty wide-ranging and unilateral power. So that being said, we were urging him very strongly to use that power to get the most vulnerable people out of these facilities at the state level, in the state facilities. He did issue an order. It had a lot of restrictions, which limited the total number of people who might even be eligible for that reprieve. It limited it to a small number of people. And as Salim had mentioned, to date, I think I just checked the site, there've been 116 people who have been let out. They had originally said between 1,500 and 1,800 people may be eligible for reprieve. And the order was issued on April 10th. And so the two things that we're sort of focusing on the one hand, is asking Governor Wolf to issue a new order that would expand the criteria to include more people, to make more people eligible for the reprieve. And the second is, in terms of the people who are eligible under the current order, is asking the Department of Corrections really what's taking so long, so that we understand that there is, of course, a process that people have to go through before they're released. But the fact that there have only been a handful of people really released since April 10th is a bit worrisome and completely unacceptable as far as we're concerned. So that's sort of what and we also are about to make an ask for universal testing that we're going to send both to Allegheny County and to the Department of Corrections. And sorry, I'm going to wrap up since we're running a little behind. I will say that the second level of what we've been doing is at the level of the county. So most of what we've been doing instead of advocacy is litigation at the county jails. We had two cases in Philadelphia, one that we filed in Allegheny County about some of the conditions in the prisons, or I'm sorry, the jails in Allegheny County and in Philadelphia. The Allegheny and Philly conditions cases are still ongoing. I will say that and we also have had a bit relatedly, some immigration cases that were successful, but are currently now, some of the detainees that were released have now been ordered to return to 3 county jails, York, Clinton, and Pike County jails, because there are some immigration detainees that are kept there. So I'll just sort of leave it at this, which is, we're seeing very tepid movement at the state level from the state facilities. I will say that Allegheny County has been actually doing pretty well at decarcerating, and that some of the rural jails have been doing a decent job. Philadelphia has been largely abysmal. It has to do a lot with the judges and their orders, and so that's sort of where we've been focusing our attention. And I can send some additional info. I'll post it when I can get back online to the group. So thanks, Celeste. Sorry.
Thank you so much, Liz. I appreciate you sticking it out with technology issues. I think the talk of the town tonight will be the fact that DA Krasner has a cat. So welcome to the panel, DA Krasner's cat. We're going to go now to Neil Msangi, who is the legal director of the Pennsylvania Innocence Project.
Hi, everyone. Thanks, Celeste, for inviting us to participate, and to everybody for all the good work that they're doing. Our name is pretty self-explanatory. I think most of you know what we at the Pennsylvania Innocence Project do, which is try to get relief for those who have been wrongly convicted and are in fact innocent of the crime for which they were convicted. In this COVID-19 space, unfortunately, the prison health crisis hit our organization almost immediately and very tragically, with one of the individuals who we had been working with and believe is innocent, was the first prisoner in the state system to pass away due to the virus. So, and that's my dog joining us. So we have really focused our efforts on trying to think about what we can do to prevent that from happening to anyone else. And unfortunately, I think the sad fact is it will happen to other people. We, like many others represented here, have asked the governor to exercise his reprieve power in a much more expansive way, to consider including lifers, who would not be a threat to public safety in that reprieve power. So far, I don't think those efforts have been successful, but I hope we can all continue to join our voices to push for that. And I think that what this whole experience has highlighted for us, in relating to something that DA Krasner pointed out at the beginning, is that when things start to reopen, courts are not going to go back to normal. And post-conviction matters, the cases we work on for people who have already been convicted, tend to take years and years and be some of the slowest to move in the system to begin with, much less in whatever the new normal of courts is going to look like. So for us, I think this has highlighted that we need to continue the push that most of us had been making even before the crisis for a more robust clemency process in Pennsylvania, where commutation is a serious and viable option for our folks, even if they are lifers, and that also acceptance of responsibility not be viewed by the board as a dispositive factor. I think under Governor Fetterman's leadership, we have seen some more open-mindedness at the board to people who are applying for commutation and maintaining innocence. And our hope is that we can see that continue to open up and be a viable option, and make that a real push that we need to continue even when we are sort of coming out of the current crisis. So I'll wrap up. I know we're behind time, but thank you again, Celeste, for having us, and everyone to bear with my dog, who is obviously very upset by this crisis as well.
My dog just started whining too. So I know we are a little bit behind on time, but any questions that were submitted ahead of time, we are trying to address them with the panels. But I also will make sure that if there are any questions that are unanswered, we will get those answers out to everybody who attended this webinar tonight. So I am Celeste Trusty. I'm the Pennsylvania State Policy Director for FAM. I just want to really quick talk about the things that we're doing right now during COVID, but also some of the next steps that we think are important. And I want to thank all the people who did join us today. It's been great really working with all of you in coalition on trying to advance some of these issues, like we were saying before COVID hit, but now while this is happening, but then also in the future. So just like a lot of the other organizations represented here in late March, we did write to Governor Wolf as well, urging him to use his reprieve power to release vulnerable and aging people in prison. As was mentioned, the Reprieve Order was issued on April 10th. However, we have only seen, I think as of today, it actually might be 133 people who have been issued reprieves. Which is still just, unfortunately not nearly as many people as we were hoping to see released. And so we also asked people on the ground to take action as well, contacting Governor Wolf, asking him to use this reprieve power. It's great that we are seeing a reduction in the population in the prison. We have seen the DOC taking steps. They've actually decreased the prison population by 2,155 people since March 1st. So that is definitely a great step, but we also know that so much more can be done. Liz mentioned that in Pennsylvania, the governor's reprieve power is kind of unchecked and unfettered. And so we are hoping that now that we're seeing deaths and outbreaks in another in the second facility, that we're able to kind of put pressure on Governor Wolf and other stakeholders and policymakers and decision makers to do whatever they can in order to help release people who are vulnerable in our prisons. We sent another letter today to Governor Wolf and Secretary Wetzel, really asking for them to expand testing of people who are living inside of their prisons. We have seen an outbreak at SCI Huntington, which is now the second prison where we've seen an outbreak. At SCI Phoenix, which is where the first facility where we saw so many cases come through. We saw, unfortunately, 3 people who died. One of those people was a Pennsylvania Innocence Project client. And so we are so worried that we're going to continue to see more and more deaths. Over the last few days, the cases at SCI Huntington have really exploded. And so we are so grateful for the steps that have been taken to protect the people inside. But we really hope that expanded testing can really, really make a difference in helping to mitigate the spread of this disease. So as far as next steps go, our legislature has largely been pretty inactive on making a big difference in sentencing reform in Pennsylvania. Pennsylvania, our system is extremely draconian. We basically punish people for far too long. And all evidence shows that, mandatory minimum sentences and these extremely long sentences that we have, people serving virtual life without parole, they do not benefit public safety. And so a lot of the things we're going to be focusing on for next steps are things that are going to be looking at second look, expanding compassionate release mechanisms, allowing more people to have the authority to act in situations like this. Right now, authority is so limited. And so even if people in the DOC are wanting to create mass releases for people who are vulnerable, unfortunately, their hands are tied. And so we know that we have to lean on our legislature to take action. We're looking at, again, we cannot forget our probation reform. We have been working in coalition with, again, a lot of the people on this call on advancing probation reform. We need to look at parole reform. We need to look at presumptive parole. We need to look at ways to allow for people who have been incarcerated far too long to be able to come home. Medical parole, geriatric parole. These are all things that have been discussed in our legislature, but unfortunately, a lot of these things have not moved. And so we need to take whatever power that we have on the ground within our organizations and use that to collectively change our system. And so I really, really hope that everyone who attended tonight feels empowered, feels that there are things that they can do to get involved with the organizations that have been represented here in order to help make a change. You will be getting a follow-up email with information about everybody who has spoken here, all of the organizations that have been represented. And I really encourage you to reach out, find ways that you can get involved. Most of us have, action alerts on our websites. We have emails, we have events. We're doing a lot of these town halls. We cannot let our criminal justice reform issues fall by the wayside. I believe it was Ashley who mentioned this, that we really need to keep these issues in the forefront. And this pandemic has really highlighted the cracks in our system. And I think that now people might begin to see what we have been calling for all of these years, that sentencing reform is not just about us screaming to help our loved ones. It is about public safety. And at this point, it really shows that it is about public health as well. So I really want to thank everyone who took their time tonight. I know everybody's busy. Everyone has pets who are calling them and families who need them and work that is calling them. So thank you all so much for joining. Everybody who attended, thank you so much for taking the time to attend. I hope you found it interesting and I hope you found it motivating. And we hope to see you all soon. So thank you very much. We'll talk to you later.